I had been putting filler in my lips for a long time and I wasn't getting the shape that I wanted. They were just big and weighed down. So I got a surgical lip lift where they lift from an incision under the nose and it gave me that youthful pout that I love.
Something is happening in the beauty world where lip filler is no longer enough for some people. For years, filler was marketed as the quick little fix. You go in, you get a syringe, your lips look fuller, you take a cute selfie, and boom, new face unlocked. But now more women are realizing that filler does not always give you the shape you want. Sometimes it just makes the lips bigger, heavier, puffier, or migrated, but not necessarily prettier. And that is where lip lifts entered the chat.
Talk about my surgical lip lift that I had done a month and a week ago. I got a surgical lip lift, which is basically a procedure where they cut underneath your nose, they remove a piece of skin and make your philtrum, which is the space in between your nose and your lip, shorter. I also got it because lip filler does not last on me, and I ended up wasting thousands of dollars trying to get lip filler and it just wasn't working for me. So ultimately I decided I'm going to dissolve my lip filler and I'm going to go get a lip lift. I got my surgery May 12th and I was awake for the procedure. It was very quick. He gave me a Valium, numbed me up, did the procedure, hopped off the table. This is a picture directly before I went on the table and this is a picture directly after. So as you guys can see in the first picture, my philtrum is long, my lip is tiny, you can't even see it. And then this is immediately after. Immediately after, I was like, I wish I would have did a little bit more. But ultimately, I'm happy with my decision. And Dr. Mascara was like, no, I think you did the perfect amount. Any more, I think would be too much. I did have a little bit of pain the same day of the procedure, but the next day, I literally did not even take Tylenol. I didn't take Tylenol, ibuprofen, nothing. I took no pain pills. The next day, this is my scar. And this is only a month and a week out, so it's going to continue to get better. If you guys have any questions, please let me know.
So this is before my lip lift. As you can see, the philtrum is a lot longer. The top lip is flatter and thinner. And this is after, so you can tell a huge difference. It's shorter, the top lip is fuller, and it's more round. Okay, so I think this is the day of. As you can see, the scarring, how much is lifted. I also got the thread lift done, which I don't recommend, by the way. It doesn't work.
For people who feel like their top lip disappears when they smile or their filler keeps weighing their lip down, I can see why this would sound tempting.
I will gladly talk about my lip lift. Let's take it back to what I looked like before. This. Wait, no. Wait, this was with 2 syringes of filler. Hold up. All right, I got it this time. This is how God made me. I had nothing. Why is it bouncing like that? My ex-boyfriend used to say I didn't have lips. I had mouth edges. So at the spry age of 21, I started getting lip filler. This is me with 2 syringes of filler in my lips. The M shape is going crazy. I wanted shaped lips, so what do? You get more filler. This is probably 6 syringes of filler at this point, and they still weren't shaped like lips because they were turning under. So I was going every 6 weeks to get a full syringe of filler in my lips. Eventually, I got shape, but a ton of migration. This is what I looked like right before my lip lift. That filter was driving me absolutely crazy. These are the stages of my lips. This is ideally what looked fine, but I remember taking this picture and it was the day after I got injected. So as soon as the swelling goes down, we're right back here until eventually we're here. And before you get started with, oh, your injector sucks, I went to over 6 injectors, fully dissolved and started over every single year. But the anatomy of my mouth was not suited for filler. My lip would fall under, we could not get shape. It just looked a mess. So I did my little research and I found out about a surgical lip lift. What they do is cut a little bit of your skin off and they pull your lip up and sew it to your nose. What you see markered out here, that's what he cut off. And here's the thing with the surgery. More people than not get multiple of them. The doctors, of course, and the patients want to be careful. They want to be conservative. So they do it a little bit and people want more taken off. Knowing this, I harassed my surgeon to take as much as humanly possible off. And he understood the freaking assignment. I am so in love with my results. I have 0.7 syringes of filler in my lips now. Surgery is not for everyone. Most importantly, as always, you need to do so much research. I've seen so many bad cases, bad scars, uneven lips, and a lot of surgeons actually don't do this procedure at all. It is done under local anesthesia. Mine was $3,200 and the healing process was super quick for me. This is what mine looked like 3 to 4 weeks after the surgery. This is before I got filler again.
But let's be very clear. This is not a lip gloss. This is not a cute little maintenance appointment before brunch. This is a real surgery with a real incision and a real scar sitting right in the middle of your face. And that's the part I think social media sometimes makes look way too casual.
I'm getting way more consults for lip lifts than I am for lip filler, and I'll tell you why. First things first, this is early in the healing process. I think your stitches have been out for maybe a week or 2, so you can still see that scar, and you will for a while. But when that thing fades to basically nothing, I will tell you that you have a much more balanced lower third of your face. Filler makes the lips stick out. There's no way around that. You're adding volume to a fixed area. It's going to stretch and make the lips stick out a bit. And for some people, that's okay. But when you have a long upper lip, a lip lift can be a better technique as long as you're okay with the scar.
This is actually the first day after surgery. My lip is super swollen. I do not try to move it a lot. I will get picked up in like an hour, no, 40 minutes to get a checkup on this. And so I started bleeding a little and swelling, but I'm actually in very low pain. I have no pain at all. Yesterday I had a little pain, so I took a little pain medication, but today I feel besides of the swelling, I look like I don't know, like a duck. Everything is fine, and I will keep you posted, guys.
Out of all of my cosmetic procedures, I honestly think that my lip lift is what I am most happy I got done. And I don't want to suggest that people's first option is a surgical lip lift, because sometimes it isn't the right option. Sometimes it's done and you're left with this really gnarly looking scar in the middle of your face. Sometimes it gets super discolored. Sometimes it can mess up your nose. So before you opt to see if you qualify for a lip lift, which I did, I would say try doing filler, try doing a lip flip with Botox, see if you like that. But for me personally, the space between my nose and my mouth, it's called your philtrum, was like this big. And so no matter how much filler or Botox, it wasn't going to fix my problem.
Because one minute people are saying, oh, my lip filler migrated, I hate the way it looks. And the next minute the algorithm is feeding them videos of women saying their lip lift was the best decision they ever made. And honestly, I understand both sides. Some people genuinely have anatomy where filler is never going to give them the look they want. Their lip turns under, the filler migrates, the shape never looks right, and they end up spending thousands of dollars just to keep chasing a result that lasts for 2 weeks.
2 months ago, I had a surgical lip lift to lift my upper lip and to create the distance between here and here shorter. And I was like really honest with my surgeon and with everyone there that yes, I see a difference. It's a noticeable difference. I see it. But just because there's a difference doesn't mean that I am fully happy with my results. He did a great job. The team was amazing. The whole experience was great. But the result I wanted to achieve, I think we got there by like 50%. And then what's really hard is that, you know, they show me my before and after, which they printed out for me. The photo on the left is my before. Photo on the right is my after, which they took my after picture today. And in the two photos, you do see a clear difference, which again, I'm not saying that there's no difference. It just, what I'm seeing is that it's not drastic, that's the wrong word, but not the result I wanted to achieve. I would have liked a little bit more removed so that way you can see more of my teeth. And yes, when I talk, you can see my teeth, of course. But when I'm at rest, like you barely see any teeth, and I just wanted to see my teeth. And I understand he was afraid that I'm gonna get a gummy smile, but my teeth are pretty large and it would take a lot for you to see my gums. You'd have to like really make me smile crazy to see my gums. So I'm feeling a little down. I need some encouragement. We addressed my scar. It's only been 2 months. He did give me an injection to help with the scar. I'm gonna go see him in 2 weeks to see if the scar has gotten any better. If not, he'll give me another injection and then I'll probably go back again. And then if not, he would revise the scar. But yeah, I'm feeling like a little bit down.
So let's talk about my experience with right after I had my lip lift. The first thing I noticed coming out of recovery is that I was showing more teeth, because this is actually shortened. This skin under my nose to my top lip, that is what gets shortened. This is not a flip, so you're not seeing more lip. This is what's gotten shortened. You are going to be showing more teeth when you're resting, smiling, and speaking than you did pre-surgery. The incision that my surgeon made for my lip lift is actually right under my nose. And I don't have any makeup on, any face makeup on to cover it up. 10 months post-op, this is really what I want to tell you. So the lip lift has actually changed how I speak, how my lips actually form words has changed just slightly since pre-surgery. How my lips wrap around certain words has changed, and I'm a little bit more conscious of it. And I don't know if it's because your lip is still a little stiff, but it's definitely changed how I speak.
So when they find out there is a surgery that can fix the shape instead of constantly adding more filler, of course it starts sounding like the better option. But this is also where it gets tricky, because now lip lifts are starting to feel like the new beauty shortcut. And anytime a surgery starts getting treated like a trend, I get nervous. Because trends change. Your face does not bounce back from surgery the same way your closet bounces back from a bad outfit.
So it has been exactly 1 month since my lip lift. Here's a little update close up. You know, no beauty filter per usual. The scar is a little bit red, but it's just going through the healing process. I still have stitches like on the inside that are going to dissolve over time. My doctor put a steroid shot in it about 2 weeks ago. He also added some more lip filler because I was depressed about that. You know, I can smile. Everything still feels a little tight, but I'm loving it. I have to wear sunscreen over it every day, no more ointment. And then I now use this like silicone scar gel. It's been a week since my lip lift surgeries. Today is the day we are going to get these stitches removed. This is what they're looking like now. Not gonna lie, I am nervous, but gotta do it. Hopefully everything healed correctly. Let's go.
Myself. I'm so scared right now.
So cute, like the second or third day with the swelling. It's so weird, I know. Stitches came out. Oh my god, that was scary. All that is just scabbing. He said everything looks great and I am cleared to start working out again, which I'm going to be doing tomorrow. Cleared to start taking care of the scars. So I'm going to be using Mederma in the PM and Bio Oil in the AM. Lots of SPF, has to be like over 30. And I think that's it. They said in about 3 months I can start looking into like radio frequency, microneedling, things like that if I want to lighten it up.
You're going to have a scar. Okay. Everybody scars differently. This is mine. And here is my scar with makeup on.
Everybody says, but what about the scar? But what about the scar? What about the scar? How many times I hear that?
Yeah.
Okay. This is real life though. Real life. You do not see it.
With the right surgical technique, lasers to modify the healing process, that scar will basically fade to nothing. And I don't care what people tell you when they say they can always notice a lip lift scar. That's not a thing. It's not to say you should be doing this procedure. Not everyone should get this, but it is an option beyond filler. And we know that there are some good things about filler. I'm not demonizing it, but there are also some things that aren't that great.
And the scar conversation is a big one. Some people heal beautifully. Their scar fades, makeup covers it, and they love the results. But other people are left with redness, thick scars, uneven lips, tightness, or results that are way more subtle than they expected. Some women even say it changed the way they speak or the way their lips form certain words. That is not something people always think about when they are watching a 30-second before and after video.
Here we have a good candidate for a lip lift. If we start off by looking at the width of the nose, 33 centimeters, looking at the width of the mouth, 4.5 centimeters, comfortably over 50% relationship. Length of the lip, 17 millimeters. So we're going to remove 4 millimeters from her upper lip. We're going to place the incision where the lip meets the nose, right in that crease. Now we're going to measure the 4 millimeters that we're going to remove from the lip. And we have measured this on a caliper, so it's 4 millimeters all the way along. And then it's a simple case of joining the dots. Now the bullhorn component. We're going to check that it's equal. We're going to remove the skin from the top line to the bottom line. We're going to stitch that bottom line up to where the top line is, and the effect that you're going to have on the lip is that.
Oh God. All right, so this is what we call a direct lip lift. You make a cut like right above the lip and then flip the mucosa outwards so you create a bigger lip. Patient already has a bullhorn lip because he already has a scar right under the nose. I never do the direct lip lift because the scar will become better than what you see right now because it still has the stitches in, but it will never become like totally invisible. It can also give you some issues with how you use your lips in your mouth. I'm definitely not a fan of this technique. I would prefer the bullhorn lip. Scar on the bullhorn lip is really not visible, but this one for me, no go.
All right, so this is a direct lip lift where the incisions for the lip lift are made right on the vermilion border. That's different from a subnasal approach where the incision is made at the base of the nose. Now, there are some pros and cons to each of these techniques. The advantage of the subnasal approach is that we're able to lift more of the center of the lip, but in a way where we can hide the actual scar at the base of the nose, so it's really difficult to see it if it's performed well and if the patient heals well. There's a disadvantage to the subnasal lift in that you're not really lifting the sides or the corners of the mouth as much. Now, a different procedure is called a corner lip lift, and that's closer to something like this, where you're making an incision along the vermilion border but out laterally. So you're not going into the cupid's bow, you're working out laterally and you're removing about a triangular shaped piece of skin in order to bring the pink lip up. Sometimes those two are combined, subnasal lip lift with a corner lip lift. My preference is usually to do a subnasal approach first, wait 3 months and see if the person even needs a corner lip lift. A direct lip lift is different because you're making an incision along the entire vermilion border, including the cupid's bow. And that's where I don't like this approach, because when you mess with the cupid's bow and you make an incision directly in that central portion, you start to blur those boundaries where the vermilion ends and the cutaneous lip begins. And if you do that, it's very difficult to reconstruct it, and it can start to look like something isn't quite natural. Maintaining that central cupid's bow region and the peaks there is very important, and it's something that is better not to mess with surgically.
Unpopular opinion, I am not a fan of lip lifts in people under 35 or maybe even 40. The main reason is that young skin heals differently than old skin. So younger skin heals more actively, more collagen deposition, thicker scars, redder scars, higher chance of poorer scars. The central face actually heals worse than the outer face. So if you are looking for a high-risk incision that is more likely to be visible, you want to do it on a younger person in the middle of their face. If you are looking for a low-risk incision that is less likely to be visible, older, the same person when they're 20 or 30 years older is less likely to have a visible scar, and then other areas of the body, all right, other areas of the face. Second reason I'm not a fan of lip lifts in people under 35 or maybe even under 40 is they generally are not indicated. They generally make people look very stylized, and to each her own. You can have whatever you want. It's your life to live. But if you ask, is it natural looking on most people 35 and under? No, but again, that's your choice. The final reason I'm not a huge fan is I'm not a huge fan of the fact that it's just easy overall to do a lip lift. And so I think they're getting pushed a little bit because surgeons that are just starting out find it an easy procedure to offer under local anesthesia. And it seems like, oh, it's just a little kind of thing. Easy kind of get your feet wet kind of procedure. And honestly, it really belongs in the aging face population where people's lips are getting longer, where they're older, their skin is thinner, they're less likely to see a scar, and they have a lot more to gain aesthetically.
And then you have doctors warning that lip lifts may not be ideal for younger people, especially if they don't actually need one. Because younger skin can heal more aggressively, which can sometimes mean thicker or more visible scarring. So while social media is making it look like everybody needs a shorter philtrum and a more lifted top lip, some surgeons are saying, actually, slow down. And I think that is the real conversation here. Lip lifts are becoming popular because people are tired of filler. They're tired of migration. They're tired of paying for results that disappear. They're tired of lips that look big but not shaped. And honestly, a lot of people are realizing that filler cannot fix everything. But at the same time, we have to stop acting like every insecurity needs a permanent solution. Because the beauty industry has a way of taking one small feature and making it feel like an emergency. First, it was thin lips. Then it was lip filler. Then it was filler migration. Now it's lip lifts. And before you know it, everybody is staring at the space between their nose and mouth like it personally ruined their life. So yes, lip lifts are popular because they can give a more lifted, youthful, structured look. But they're also popular because people are exhausted from chasing filler results that don't last. And they're popular because TikTok has a way of making surgery look way more normal than it actually is. At the end of the day, I'm not saying lip lifts are good or bad. For the right person, with the right surgeon, it can make a huge difference. But I am saying this is one of those procedures where you really need to do your research, look at healed results, understand the scar risk, and ask yourself if this is something you truly want, or if the internet just convinced you that your natural lip was a problem.